Alright, hello everybody. Welcome back for another video. Today we're actually going to be covering the lymphatic system for Bio 211 and a little bit of 202 as well. So let's go ahead and jump into it. Alright, so the first primary thing that we want to pay attention to is that with regards to the identification portion of the exam, we have a lot of different cells that we can see. We can see neutrophils, eosinophils, basophils, lymphocytes, as well as monocytes. And we will get into each individual function of what these guys do, what they're capable of, as well as how to identify them under the histology slides as well. So it's going to be fun. Now, the first thing that I kind of want to cover for you guys is the difference between innate immunity and specific. Now, there's a pretty straightforward definition. Honestly, as you can tell by the word, innate is basically native. So it's something that the body already has that's constantly protecting you against pathogens. The innate system is pretty wide range. It includes pretty much all of your skin, anything that serves as a physical barrier, like your mucosal membranes as well. And then it's also going to include a lot of our leukocytes that are naturally going to target any kind of pathogens like bacteria, or viruses, or fungi that would want to do us harm. The specific immunity, on the other hand, is primarily going to target viruses and also through the means of antibodies. So we'll kind of actually taking a look back at the previous kind of cell types that we have here. We got neutrophils, eosinophils, basophils, and monocytes. All four of these guys will actually be part of the innate immune system. These are going to be the natural guys that are going to be out on the hunt for pathogens that might be patrolling the body. Our lymphocytes, on the other hand, there's going to be a very specific component of the lymphocytes that we'll talk about with regards to how antibodies are actually going to target various pathogens as well. So something that can be recognized as something that's a little bit more specific, as implied by specific immunity. So first thing that we're actually taking a look at is kind of the progression for how these sites come about. Now, what I want you to really focus on is that the neutrophil, eosinophil, and basophil are all they're all kind of coming from this single precursor right here. These are known as granulocytes. So we have neutrophil, eosinophil, basophil. These are all known as granulocytes. Granulocytes pretty much have these tiny little granules found in the cytoplasm here, as you can see. All these little dots everywhere. These granules are actually super productive in helping the immune system fight back against various pathogens. As we can see down here, our monocytes and T and B lymphocyte come from a different progenitor, and these guys are actually going to be known as agranulocytes. So we got T lymphocytes, B lymphocytes. They can kind of be grouped up together as just a single lymphocyte, and then our monocytes are also going to be agranulocytes. So if we're kind of splitting the line here, these guys are going to be the granulocytes, and then our agranulocytes would be down here. So first thing we're taking a look at is the monocyte. So the monocyte is pretty easy to identify because, again, it's an agranulocyte, which means it does not have any granules. So inside of the cytoplasm itself, it does not have anything that is going to be an indicator of any kind of granules. It's going to have a bean-shaped nucleus, right? So it's all one single nucleus, all one single lobe, and it's going to have like this indentation here that kind of makes it look like a little bit like a bean. Now, what a monocyte is essentially a precursor to a macrophage. So let's kind of spell that word out. And if we break up that word macrophage, macro means big, phage means eat. So basically, these are going to be our big eaters. Basically, our monocytes and macrophages, they're going to phagocytize any kind of pathogen that they have in the environment. They're very indiscriminatory. They'll kind of just about eat anything from the environment that's not supposed to belong, but they're pretty much going to intake it through that method that we just discussed earlier. Another agranulocyte that we have is the lymphocyte. It's going to be large, round, and a single nucleus without any granules. So you can see the single nucleus found in the center of the cell. Now, we previously described that there are going to be T lymphocytes and B lymphocytes, and we kind of have to discuss the difference between those two guys and why that's important. So for our T lymphocytes, the T and T lymphocytes actually is going to stand for the thymus, and the B for B lymphocytes is going to stand for bone. Now, something to clear up right off the bat is that all of our cells through hemipoiesis, all of our cells are going to be coming from bone marrow. Bone marrow is going to be the ultimate source for where our cells are coming from. Now, as a matter of where these cells go to mature, well, that's where they start to differentiate a little bit. Our T lymphocytes are going to travel from the bone marrow, right? So they were created in the bone marrow, and they're going to migrate over to the thymus to become more mature and to become more ready to fight pathogens. On the other hand, our B lymphocytes instead will stay inside the bone marrow and mature inside of the bone marrow. So they never leave until they're mature and they're ready to move on. Next up, we have our granulocytes. You can see all these tiny individual granules found here in the cytoplasm. First up, we have our neutrophil. Now, our neutrophil is going to be 3 to 5 lobes. Now, it's all one single nucleus still. A lot of students get confused, but it is still one single nucleus. It's just divided into various lobes. The neutrophil is easily going to have the most amount of lobes in any of our leukocytes. So if you're taking a look at our leukocytes and you notice that one of our cells just has an incredible ton of lobes, it's always going to be a neutrophil. Our neutrophils focus on one thing and one thing only. They're going to focus on bacteria. They do not like bacteria at all. They use a lot of different mechanisms of how to attack this bacteria. I don't want to go into too much detail. I just want to give you guys a very brief idea that, our neutrophils, they can use hydrogen peroxide, which is a fairly corrosive chemical, something like this, H2O2, to basically punch holes in our pathogens and our bacteria and, get rid of them. Next up, we have our basophil. It's going to be bilobed, and it's going to have a blue/purplish look to it, and we'll kind of go over that, like why that's important in just a minute, because our eosinophils and basophils are often the ones that are most commonly confused with one another. So you can actually see the difference in the bilobe here and here, right? So that's going to be our two different lobes of the nucleus. Now, our basophils do not directly attack anybody. What they're going to mainly do is they're going to be kind of like more of a support cell. So they actually secrete a few different factors that are really important for us. So it's going to be the factor of histamine as well as heparin. So these two factors are actually going to help us out a lot, because histamine is actually going to act as a vasodilator. So what that's going to do, that's going to allow for a lot of blood to start rushing through the vessels more. And what that's going to eventually do is that's going to eventually bring a lot more of the leukocytes to the site of infection, or to the site of inflammation. This is kind of where inflammation occurs. So histamine is inflammation causing, which means we're going to get a lot of blood rushing to the area of infection because we want as many leukocytes to deal with the problem as possible. Heparin, on the other hand, heparin actually serves as an anticoagulant. So with all this blood kind of grouping up into a single area, we want to make sure that we are not accidentally clotting, because that's the last thing that we need right now. We don't want our blood to be clotting because there's not any kind of laceration or breakage in our skin that we need to clot up. It's more so just the fact that we have an invader, and we want to make sure that we have a lot of blood there to deal with that invader, but we don't want that to coagulate. Taking a look over here, we have eosinophil. So eosinophil is also going to be bilobed, and it's going to have a reddish orange tinge to it. So we can see it's a little bit more of a pinkish color to me personally, but an easy way to kind of differentiate eosinophil from basophil is by the colors. And an easy way to remember the colors is to take a look at this first prefix here, eos. So eos actually translates from Greek, and it actually translates as love. Right? So the reason why we have this kind of love hormone, sorry, my mistake. The reason why we have this kind of like love granulocyte is because of the kind of dye that we have here. So we can see it's like a very romantic-ish, very Valentine's Day-y kind of look to it. So that's where they kind of get this eos, or love, for it. And our eosinophils are actually pretty productive. Our eosinophils are going to help out in two conditions. Whenever we have parasites, and whenever we have allergies. That's going to be the main objective for our eosinophils to help out, is whenever there are parasites or allergies. Alright, so now we're looking into a bit more classification of lymphocytes. So let's start over here. First up, we have our NK cells. Okay, that just kind of erased everything there. Let's Let's see if I can erase that real quick. Okay, so first up we have our NK cells. Now NK is going to stand for natural killer cells. They are part of the type of lymphocyte. These are going to also be part of our innate immune system. So these are the only guys that are basically not going to be acquired or a specific immunity. Now our NK cells basically act like a surveillance. So they're going to constantly be circulating around in the lymphatic system and just kind of keep an eye on things. Now our B cells are actually going to eventually differentiate into what are known as plasma cells, right? And what do we find in the plasma? Inside of the plasma is where we find antibodies. So this is actually how we start to develop antibodies, is through the B cells and how they're able to secrete these antibodies by turning into plasma cells once they have become A, mature, and B, experienced. And we'll kind of talk about how they gain experience when we start talking about the lymph node. In the meantime, we got our T cells over here. So memory T cells are basically going to serve the same kind of function as our B cells, is they are going to remember the pathogen and check if it's been previously encountered so that there's a quicker route to the solution. For our suppressor T cells do exactly what they're expected to do. They are going to tone down the inflammation response. So pretty much if something crazy is going on with an infection and it's a lot to handle, it's a lot of strain on the body, the suppressor T cells are pretty much going to alleviate that pressure. Also, when our body is done fighting an infection, we also want to be able to suppress the immune system. We don't want it overactive. Then we got our helper T cells. Our helper T cells are going to basically be a lot of initiation. So they're going to be stimulating and activating and basically doing kind of like what the basophils did previously when we described our basophils. Our helper T cells are more specific just to allow for easier communication with T cells and B cells. And then finally we have our cytotoxic T cells. So these guys are the most interesting. The cytotoxic T cells are what are going to actively be attacking the parasites and pathogens. So these guys are our warrior units, right? So they're going to actually be the ones on the attack. We do have a few different tonsils. So we have a pharyngeal, palatine, lingual, and tubule tonsil. Now, the tonsils in general, they are just going to serve as a guard for the opening entrance to your mouth. Our tonsils actually follow a very similar histology to our lymph node, and they're pretty much just going to also be used to like protection for the mouth, make sure that any kind of pathogens that are entering can easily be dealt with. Lacteals, just to give you a very basic definition of what a lacteal is. A lacteal is found in our intestinal tract, or instead of our gastrointestinal tract, and this is actually how we're going to absorb lipids. So lipids are also going to be absorbed into the lymphatic system through these lacteals. But honestly, I kind of like to explain them more when we get to the GI tract. We also have the thymus. We previously described the thymus, found in the anterior thoracic cavity and the anterior mediastinum in front of the heart. Usually the thymus is not going to be seen on the cadavers because by the time you're getting past puberty, the thymus is pretty much atrophying. The thymus is a huge component in terms of the immune system when you are a child, but afterwards it's not as important. The spleen, we'll get into a little bit of the spleen, what that does as well in just a minute. Skip that. Okay, so for our spleen, we have what is located as a red pulp and a white pulp of the spleen. Now, go figure, red pulp is red, white pulp is white, right? That's pretty self-explanatory. Now, the white pulp of the spleen is actually going to represent a lymph node. So this is going to be where all the leukocytes are pretty much gathered up within a spleen. A lot of macrophages that are kind of roaming around as well, just to kind of, survey the anatomy, make sure there's no kind of pathogens, anything like that. The red pulp is going to be a lot of our red blood cells, our erythrocytes. So your spleen just kind of works generally as kind of like a recycling center for your erythrocytes. If you got some dysfunctional erythrocytes, they come into the spleen. Spleen's going to break them down and turn them into something a little bit more useful. All right, so I'm actually going to redraw my own kind of lymph node here. So just so it's easier to follow along. So I got something like this, right? And draining into the lymph node is going to be all these guys. You know what? I kind of want to go with green just because, we're dealing with lymph nodes. So we got draining into the lymph node. We got these tiny little vessels, right? And these are going to be known as the afferent vessels. These are going to be what are entering the lymph node. And then we have a single efferent vessel. Over here, this would be efferent. So, easy way to remember afferent and then efferent. A comes before E in the letter of the alphabet, so that we have to first arrive before we can leave. Also, efferent starts with an E, and so does exit, so it would be exiting the lymph node. Now we have a few different sections of our lymph node. Now the first thing I'm going to do is I'm going to draw these kind of lines right here. So these kind of like lines that I'm drawing are going to be known as trabeculae. So the trabeculae actually translates from Latin as meaning branching. So it's going to be these tiny little branching segments that are kind of protruding into the cortex of the lymph node. And that's what I'm going to do next. I'm going to divide the lymph node into a few different sections. So here we have the cortex, we have the medulla, and we have the sinus. So inside of the cortex, we'll work our way from out to in. We have these little circles right here, right? Various circles. And these are going to be known as germinal centers. Germinal centers. Now, found within the germinal centers are actually going to be our B cells, or our B lymphocytes. Now, the reason why this is important is because when we previously talked about our B lymphocytes are born in the bone marrow, right? And then they're going to mature in the bone marrow, but just because these B lymphocytes are mature does not mean that they are experienced. So even though they're well developed, they still don't exactly know what the pathogens look like, right? And one of the biggest things key to like a war is you want to be able to know what your enemy looks like. So what these B lymphocytes are going to do, they're going to travel to the lymph nodes, right, within the lymphatic system, and they are going to reside within these germinal centers here. So you can think of this entire lymph node as kind of like a border patrol like checkpoint, right? These germinal centers here, these germinal centers are actually where the B cells are going to be using as an interrogation room. So as our pathogens kind of flow in, right, or all of our lymph in general, as all of our lymph starts to flow in, it's pretty generally random, like just kind of randomly checking the blood. All these guys are going to flow in, and they're going to kind of get migrated through these germinal centers so that the B cells can recognize and identify what the pathogens look like, so that when they differentiate into plasma cells, they can create the perfect antibodies, like the perfect solution to fight them. Now, once the lymph passes through, it is going to travel into the medulla of the lymph node. And within the medulla, we're going to have our T cells. And then our T cells are going to get a piece of the action. They're going to have their memory T cells to also be able to recognize different pathogens. They're also going to be using their cytotoxic T cells to pretty much break apart any kind of pathogens that they come in contact with. And then finally, from whatever has been like not cleansed, right? Let's say we still have some pathogens. Finally, we get to the sinus, and the pathogens are thinking, oh, finally, we're free. Not so fast, because in the sinus is actually going to be our macrophages. So the macrophages, right, the aftercursor to the monocytes, our macrophages are pretty much going to consume everything else that had not been eaten already. Now, once we get up to this efferent vessel right here, this efferent vessel is actually going to keep traveling up. And what I'm going to do here is I'm going to just give myself a little bit more room. Our efferent vessel is eventually going to meet up with 3 other efferent vessels, and then they're going to join into this new lymph node. So pretty much this is like the ultimate filtration system for the immune system, right? We're going through lymph node after lymph node after lymph node, just trying to identify like these infections that are going on. Now these lymph nodes are eventually going to pile up. So lymph is draining from the ankles, and the wrists, and it's moving up, and it's going through all these lymph nodes, these various checkpoints all the way through. Some of the more important lymph nodes are probably in the axillary region and the inguinal region. All these lymph nodes are pretty much gathering up until they are going to ultimately drain into the thoracic duct. Now the thoracic duct only takes up about 75% of it, so this is going to be the approximate cutoff. Everything on the left side of the head, the left wrist, both lower extremities, and the abdomen, it's all going to ultimately drain into the thoracic duct. Now, I've taken a look around on the cadavers, and I don't think we'll be able to actually see the thoracic duct on the cadavers. Normally it's in the posterior mediastinum running along our azygos vein, but sometimes it gets cut. But ultimately, the thoracic duct is going to drain and travel all the way up until it eventually gets to the left subclavian vein. So this thoracic duct is actually eventually going to drain into the left subclavian vein, and that's where it's ultimately going to have like kind of that venous returnage, like, because that's how we want to get there. I guess I also forgot to mention a little bit how our blood gets in the lymphatic vessel itself. We have all these capillary beds of, arteries to the tissue and then back into the veins. Now, ultimately, whatever leaks through the capillaries and does not get captured by the venous system is actually going to enter our lymphatic duct. And once again, our lymphatic duct is also going to have valves because, it's under low pressure. So it's just going to have these little guys found along there. We've already talked about valves previously though, so I don't want to go too much into it. But overall, these lymphatic capillaries are going to travel back. It's going to go through our lymph node, etc., etc., and then it's going to eventually end up in the thoracic duct, which comes back into the left subclavian vein. As for the right lymphatic duct, the drainage of the right side of the body, right face, right arm, right chest, all of this is ultimately going to end up in the right subclavian vein down here. Alright, and that's it for the lymphatic system. I hope you guys enjoyed the video.